Well, this was a very important meeting. It's a meeting of the Japanese Circulation Society, which is a very close society to the ESC. We have three sessions at this meeting together with the Japanese Circulation Society. Yesterday we had one session on atrial fibrillation and heart failure, where our President-elect Barbara Cazaday and Michel Comagda were the European representatives. It was a very good discussion on the relation between atrial fibrillation and heart failure, with some interesting developments on some novelties in terms of looking at atrial fibrillation as maybe related with subtle cardiomyopathy, and that could have some implications in terms of future approach of these patients with atrial fibrillation. So there was an interesting discussion also with a Japanese perspective. In the afternoon, we had a session on the aortic valve disease, where I had the chance to represent the ESC as well as Stefan Achenbach with two Japanese colleagues, and we discussed some issues related particularly with the use of TAVI and the comparison on the use of TAVI in Japan and in Europe. Here in Japan, they're developing a very strong program, so it's picking up really fast, and they're using a very exciting program in terms of increasing the number of patients that are being submitted to TAVI. There was also some discussion on the way to approach a patient with aortic stenosis, and there was also a surgical talk on the use of surgery to repair the aortic valve. And one colleague from Japan described the experience, his experience on repairing the aortic valve from a surgical perspective. So quite interesting presentations. And today we had the joint session where we talk about coronary physiology and look at how we can use coronary physiology and intravascular imaging, which is actually one of the areas where the Japanese colleagues are very strong, and they've been some of the pioneering studies in the use of particularly of intravascular imaging coming from this country. And we had a very good discussion. Our representatives were Martin Gillard, Stefan Achenbach, and myself chairing this session together with Professor Akazaka, and we had a good discussion on how the use of coronary imaging and FFR, IFR can help in doing better patient management in patients with coronary disease undergoing coronary interventions. So in summary, it was a very successful meeting, very well attended, a very strong ESC delegation, and we really hope to continue to nurture this relationship with our Japanese colleagues.